So next, we will jump into our presentation and COVID update, and I'm going to pass it off to Lee.
Thank you, Dave. Good afternoon, Mayor, Council, members of the public. I'm Lee Wilcox, Deputy City Manager, along with Kip Harkness, one of the directors of our Emergency Operations Center. Today, we'll be presenting on a few different things. First, we'll provide some brief updates on activities undertaken by the city's EOC, the county's shift to the orange, the state's orange tier, and an update on an announcement that the governor made at noon today, as well as updates around the vaccination status in our county. And then lastly, we're going to talk about the city's shift and our community shift from one of response phase in our comprehensive emergency management philosophy to one of recovery, where I'll be joined by our Director of Office of Emergency Management, Ray Reardon, to talk about some of the logistics around that. We do practice comprehensive emergency management in the city, and one of those, that is a framework for responsibility and readiness across all different hazards, as well as all phases of the emergency management cycle. One of those important characteristics is closing the links between our mitigation, our preparedness, our response, and our recovery. And so we'll go over that today. A majority of the last 14 months for our city, we have spent in a response phase, one that lasted longer than we could have foreseen. And so the shifts of resources, our community and personnel from one of response to recovery will take planning and coordination throughout the organization and throughout the community. But for now, with our response and turning our attention to our COVID-19 response, here in the United States, we've lost over 550,000 people to this disease as of yesterday, including nearly 2,000 locally, with some 100 patients currently in our hospitals struggling with COVID-19. The economic effects of this pandemic continue, along with the continued high unemployment rate, as well as economic distress, all of which disproportionately impact our Black, Latinx, Native American individuals, communities across the nation and here in San Jose. This past month, the EOC has continued to focus on those most in need and the critical tasks. And just to highlight a few of these, this past month in March, a total of 240 new volunteers were signed up through Silicon Valley Strong to assist with food distribution, as well as vaccine outreach. 160 of these volunteers have been trained and taken the disaster service worker to help with our vaccine outreach in support of the county. We've also, with our emergency rental assistant team, since this item was in front of council on March 23rd, have reached agreement with the state of California regarding the program and its alignment to the state and local programs. We've also reached out to 360 small businesses as of March 26 in the Little Saigon, Grand Century Mall, Capitol and Tully, and Story and White Road areas in collaboration with Council District 7, Council District 5 staff, with the purpose of providing information on economic relief and recovery programs and establishing ongoing communications. In addition, the Rock and Learn waiver process is near complete. Our final inspections at all locations across the city will be done this week, and registration for summer programming set to open for scholarship eligibility families will open on April 19th. Lastly, over the past 30 days, the Beautify SJ team have removed 117 tons of trash off of our streets and servicing 225 active encampments across the city. Following the states of California's announcement that Santa Clara County has met the requirements to move into the orange tier of the state's blueprint for a safer economy, the county and the County of Santa Clara's health officer announced that the county would align with the state's framework and allow activities in the orange tier to resume effective Wednesday, the 23rd. These activities constitute changes in indoor dining, retail stores with modification, gyms and fitness centers, movie theaters, family entertainment centers, as well as zoos, museums, and aquariums. I do want to thank all of our community partners, the county, our emergency operations center, PIO team, as well as all the council offices with helping communicate this information out and the changing circumstances to our residents and to our businesses. Lastly, as of noon today, the governor announced that the state's next steps in the COVID-19 pandemic recovery would begin to move forward, and the state will be reopened by June 15th if two criteria are met. The first is if vaccine supply is sufficient for Californians 16 years and older who wish to be vaccinated. And second, hospitalization rates are stable and low. Again, this came out at noon today, and as the plan was just released, we will continue to analyze this, get additional information, and communicate out directly to the council and the community in the coming days. Moving on to vaccines, as we all know and has well been documented in the media and through various outlets, vaccine supplies continue to be a major constraint in our county's ability to administer more vaccines to residents who are currently and newly eligible. Based on the current estimates, the state of California officials believe to be allocated approximately 2.5 million first and second doses in the first half of April per week, while that amount will grow to over 3 million doses in the second half of April. However, California currently is receiving less than 2 million doses per week, roughly 1.8 million, with these numbers adjusting slightly as week to week. This is not in alignment with what the state has built out as their system, with a capacity of doing 3 million doses per week right now, with planning to administer 4 million doses per week by the end of April. Even locally, we've seen the same effects. This week, our county doses increased to nearly 72,000 doses, which is up from 58,000. But as Dr. Marty Fensterscheib said last week, that's not enough. It's literally 1/3 of the county's capacity right now, as the county's healthcare system has capacity to administer 200,000 doses per week right now. Yet even the smaller allocation has proven difficult for the county, with having to balance administering first dose appointments with those who are eligible, with prioritizing some of our most vulnerable communities, while also assuring enough second dose appointments available for those that have received their first dose. As of April 1st, the county released 32,000 appointments for people 50 and older that are now eligible. However, the county cautions that Santa Clara County has upwards of over 400,000 residents that are between the ages of 50 and 60. And while having to continue getting vaccinations to eligible populations that were previously in the expansion, the county continues to get a fraction of the numbers, so availability of appointments will continue to be a challenge. We still have a long way to go, especially since April 15th of this month. Vaccines will be eligible for anyone 16 years and older who wish to be vaccinated. As things continue to change in this dynamic space, the city will continue to prioritize advocating for our vulnerable communities and to ensure that they have access and are not left behind. And I'll come back to that subject a little bit later in the presentation. So as I mentioned before, for the last 14 months or year, everyone's been in response mode. As we detailed in a study session before the pandemic with the mayor and council, a tabletop exercise around the Emergency Operations Center and how it functions, responses usually comprise of coordination and management of resources, including personnel, equipment, and supplies, and in all hazards, earthquake, man-made, or a global pandemic. And measures are taken to protect life, property,
Lee,
and environmental safety.
I think you're one slide ahead for us, just to get us on sync. Sorry to interrupt your flow.
Am I? Well, there you go. I'm overly eager. Thank you, Kip.
You're a step ahead, that's all.
Yes, and we actually have art on this slide, which should be shown and not skipped. So we are going to start our shift into the recovery process. Within emergency management, in our cycles, recovery does overlap with the response, and it consists of those activities that continue beyond an emergency period to restore critical community functions and begin to manage stabilization efforts. The recovery phase ramps up after a response is done and the threat to human life has subsided. The goal of the recovery process is to bring those affected areas and people back to some degree of normalcy, including essential services, any physical repair, and community and economic damages. Everyone is eager for recovery, with the vaccines now beginning to be administered and hopefully ramping up soon. Recovery has come into view for many. The community and economic challenges emerging in the wake of COVID-19 have been well documented and appear daunting. Therefore, our recovery planning needs to be focused and begin now. For us to get to full-blown recovery and for us to fully step into that space, there's two important elements: getting vaccines for everyone in our community who want them, and starting to transition our organization and resources to those roadmap activities identified as part of the recovery process. So first, moving to community recovery. Community recovery is highly dependent on vaccination success. And so as we've talked about in previous council meetings and 3.1 presentations, our role in this vaccination success really hinders on our advocacy and our partnership in advocacy to ensure equitable scale and speed, adding capacity to the system, whether it's with the county or federal, state, and hospital partners, and then mobilizing and engaging our residents to get vaccinated. Our work in this space continues to be a priority for us. I want to mention a few different things that is going on now, and we'll dive into some of these individually. Around advocacy, we're working hard to advocate for our community to receive the equity-based allocation from the state. Some of the work this past month that we've engaged in is supporting and advocating alongside the County of Santa Clara, as well as other Bay Area counties and other nonprofits to ensure that vulnerable communities highly impacted by COVID-19 have equitable access to vaccinations. We have contributed our own analysis and local population statistics to letters that have been sent to the state and the governor and the legislature. And we are ensuring that vulnerable communities aren't left behind by the state's distribution plan. We've also sent dozens of letters to various state officials and have been on call with the county to take advocacy actions when requested by the county. While advocating for higher access for vaccine supply, we also are working to enhance and strengthen the local capacity of the system. And this work has involved our mutual aid staffing with the county, continuing to vaccinate eligible employees at the first responder clinic at the fairgrounds, and supporting the county with in-home vaccination. Some of the work this past month has included partnering with Kaiser to get more vaccinations in highly vulnerable, highly impacted communities. Kaiser is currently operating a vaccination clinic at the Vietnamese American Cultural Center with a commitment to vaccinate all eligible populations, especially those in the surrounding area. As of yesterday, 150 of our EMTs and paramedics in the San Jose Fire Department have been trained through the induction training program to build capacity to support the county and our healthcare partners, and I'll speak about that later. And lastly, we are continuing to support and mobilize and engage efforts to get shots in arms, and this is include conducting broad communications campaign as well as very targeted outreach and communications campaign around specific sites. We've been able to reach over 8,000 residents in the last month, and I'll dive into some of these activities now. As I mentioned, adding capacity is a key tenet of our economic recovery, and to support this, we've partnered with several federal, state, and local entities, in addition to our healthcare partners, to help vaccinate our vulnerable communities. With AKI, we've worked with this federally qualified healthcare center, specializing in delivery of support services with three large events, vaccinating roughly 1,000 people in the last month. And as I've mentioned with Kaiser Permanente, we are operating a community-wide center, not exclusively for Kaiser patients, I should say, at the Vietnamese Cultural Center. We are starting with capacity for 500 vaccinations per day with the intent to scale as supply increases. And our teams are working hard to ensure availability of Vietnamese, Spanish speaking staff, and language access materials, and information in all materials are abundant at this site. We're also working, as of yesterday, to support the county's public health department with our own fire department personnel with the county's in-home mobile vaccination program. San Jose Fire staff will be carrying out in-home vaccinations in the following zip codes: 95116, 113, 127, 122, and 121. This program vaccinates in-home or homebound individuals as defined by Medicare. The county currently has oversight of this program, and we're supporting this with our injectors through San Jose Fire. As the county has communicated to us that this program will expand and scale as additional supply of the vaccine continues to grow in the county. Also with the county, we continue to work towards providing the county with staff to bolster capacity at several of the county vaccination sites throughout San Jose. San Jose is exploring options to both recruit and use appropriate staff or part-time staff within the city to do this, as we've talked with you. As we start to reopen and move through the orange tier, some of our own employees that are currently on staff will be redeployed back to services that are opening up in our own city. So we're placing special emphasis on the second phase. And so we have been advertising for positions that we would hire and then send to the county to add capacity at our site. Thank several of the council offices for getting word out. Those are full-time positions. We're requiring people that are fluent in Spanish, Vietnamese, Mandarin, people with excellent customer service skills, and people that can start as soon as possible and work through the end of June. The posting has been up for 2 weeks and hundreds of people have applied. And we're working out final details and a memorandum of understanding with the county now. And lastly, we are supporting with logistics targeted outreach for several mobile COVID-19 clinics that the county will be hosting in the coming weeks. Mobilizing engages our hardest hit communities is our last body of work within this program. As I mentioned before, we are doing extensive lit drops in some of our hard hit census tracts around Eastridge and vaccination locations with throughout East Side with collateral in all relevant languages. We've been utilizing Project Hope staff and other community services staff to support these efforts, as well as leveraging existing outreach activities to share vaccine info when possible. And we're providing resource kit with messages to protect San Jose, information on how to get vaccinated, as well as resources at our virtual local assistance center page, hand sanitizer, and any hand notes that they need. Lastly, here are some examples of our mobilization work has looked like, and we've done some extensive canvassing, as I mentioned, for very specific vaccination events, as well as vaccination sites. These activities have been in multi-language and have reached thousands of our most vulnerable residents. It should be noted, this targeted approach has shown very positive results, compared to the rest of the county dashboard. And so we have been in conversations with the county as the access to vaccine continues to increase, hopefully in the coming weeks, that we will be in a support role of additional mobile, place-based, targeted outreach for some of our affected areas. Already we're working with Safeway, Sutter Health, and Aki again for some of our mobile events and mobile sites in the coming month, and hopefully we'll have more on the way with the county. So the second part of our presentation is how we transition our organization to recovery and start planning. And moving our community from recovery, our approach is dependent or moving our organization is dependent on advancing 3 concurrent buckets: ensuring vaccinations for our employees are accessible, funding for recovery, or more specifically, aligning possible funding sources to community and organizational needs is done. And then lastly, demobilizing our emergency response. And of course, this will occur over several months as we step into the recovery phase. For our own employees, as we reported out last month, many have become eligible with the state and county guidelines to receive their vaccination. We've completed all PD and fire sworn personnel who wanted to get vaccinated. And we've started vaccinating non-sworn city employees who are eligible as of February 25th. As eligibility continues to increase, and the county has kept the first responder clinic open at the fairgrounds, we've been able to push over 800 employees to get their first doses at that site. And we continue through the Emergency Operations Center, Human Resources Department, and Office Employee Relations to ensure all field personnel working in the Emergency Operations Center or providing essential services in the field are prioritized through this process. Turning to funding, a little bit of a recap, but since the beginning of the pandemic, Congress has passed 6 different COVID stimulus packages, with the most recent being the $1.9 trillion package entitled the American Rescue Plan. At a state level, the legislature has approved more than $13 billion in COVID response funding through budget actions earlier this year, or early budget actions, and we anticipate additional money through the regular budget process from the state as well. As a city, we've used equity as a primary driver for how our emergency relief funding is prioritized and programmed to help the most vulnerable. So too does equity drive our future advocacy efforts surrounding implementation and guidance and securing additional funding. As we look forward, we have 2 major advocacy buckets. First being the different funding pots within the American Rescue Plan. As federal agencies begin to implement this plan, we will need to ensure that San Jose and our communities in greatest need have funding. Some near-term opportunities include the rollout, which just happened, of the Emergency Rental Assistance Program, broadband program, local fiscal recovery funds, and all of the different guidance that federal departments will be laying out. The second involves a projected $40 billion surplus at the state, $26 billion of which is the state's share of the American Rescue Plan, and we're working with several different coalitions, including the League of Cities and big city mayors, to dedicate a significant portion of this surplus to our local homeless programs. There are a host of other opportunities in this area that we are engaging on related to childcare funding, low income water assistance funding, and emergency rental housing programs, just to name a few. And lastly, and importantly, the city is about halfway through with our mapping exercise to identify additional funding sources to pressing city needs. The city staff and our Ernst & Young consultants are building a funding matrix to match city needs and city direction to alternative funding sources. Our intention is to pursue these alternative funding sources so the city preserves our American Rescue Plan funding, which should be the most flexible and used as a backstop for addressing city revenues lost over the past year due to the COVID-19 pandemic, and protect the general fund and ongoing services for residents who need them the most. We'll continue to update the mayor and council as additional federal departments working on guidance release that guidance. And I'll come back to the budget process and how we will move forward with that at the end of the presentation. For our last bucket and how we will start to demobilize our emergency response, I'd like to turn it over to our director of our Office of Emergency Management, Ray Reardon.
Good afternoon. You think I know how to do this after a year, but missed the mute button. Good afternoon, I'm Ray Reardon, the director of the City Manager's Office of Emergency Management. And as Lee's been identifying, we are moving into our demobilization phase. And as he also described, the diagram you see here, emergency management is a cycle of 5 phases. prevention, mitigation, preparedness, response, and recovery. And that continues that cycle going for each hazard that we face. Within each phase, there are detailed standard activities. For response, one of the ongoing activities is to assess the ongoing threat or risk. This is also known as situational assessment. As the risk or threat increases, you add resources and adjust your action plans. In the same way, as the risk reduces, you reduce the resources and readjust your action plans. We did a great job of building up resources to the EOC in the field when the emergency was at its height. We had as many as 730 people reporting to the EOC. Now, as the situation appears to be improving, we have to be just as smart and plan a reduction of resources in the EOC. Overall, the demobilization will take us well into the summer months as we ramp up our recovery. It's not a very fast operation. We have to assess what the departments can resume and what from the EOC operations that it can accept within the existing resources, and then identify the gaps. While we continue to respond to the emergency, we reassign assets to prepare for the recovery. This is known as demobilizing. The effort is surgical. We try to be precise. We continue to assess the risk, and if the conditions warrant, we will have to build back up if it's needed. Kip, Lee, Jay, and myself have spent time with each one of the section coordinators and the branch directors to evaluate what can be either accepted back into the department or continue as part of the recovery operation. And as part of that evaluation to demobilize, staff have identified the resources and operations that will continue to operate in the support of the need of the public. Demobilization does not mean we are stopping today with all this great work. It does not mean we're closing the EOC today. In fact, we move into recovery. Some of the programs, as we've mentioned, will continue to operate outside the normal department operations. For example, the food operations. This will continue as we stand up the recovery team. The practice of demobilization and forming the recovery team is hard and complex. We don't want critical functions falling through the cracks. We need to keep the momentum going into the recovery and into resilience. We still need to meet the needs of the public and focus on the economic growth and establishing the new normal. We will also continue to adjust operations to determine the best way to use any of the federal assistance that is made available, as Lee just described. This transition will require more engagement with our partners and to understand who will continue on with us to ensure that we've addressed the needs of those most affected. At the same time, Kip, Lee, Jay, and I have been paying attention to the other conditions that we are facing, and certainly will have some action coming up. With the current Derek Caban trial, there is real potential for civil unrest. With this dry weather, wildfire, and PSP events are looming. And of course, as we have all these earthquake fault zones here in San Jose, go ahead and pick your own favorite fault. We have to be ready for that as well. So we're in the mitigation preparedness phases for those pending emergencies. Back to you, Lee.
Thank you, Ray. We've talked a little bit during 3.1 about responding, or response is about doing, and recovery is doing with. And much throughout the year in our Emergency Operations Center, we run an incident command system, and that's how we communicate. However, recovery is much different. And for recovery, for our community and organization to be successful in recovery, this joint recovery must be embedded into core work that the city does every day. As Ray's mentioned, over the next several months, some of the EOC items and programs will start to go back to city departments, while others will be moved into the recovery process. This integration into the core work of the city every day is our roadmap, the roadmap that the council and the administration put together. It will allow us to be focused and align for the most pressing needs of our community and organization. Our roadmap is our priority projects, strategies, and policies at a high level. As we start to begin more detailed discussions about each of these items in the roadmap, as well as the recovery phase overall, the administration will be returning to council. We are fortunate that the funding from both federal and state governments has been substantial. However, the community's need still outstrips our available resources. This fact makes the prioritization of these resources all the more important with equity at its forefront. We must continue to ask the question of who benefits and who is burdened. Those questions apply both to the impacts of the pandemic as well as to the allocation of relief and recovery funding. The mayor's March budget message, as amended and approved by the council on March 16th, continues to place an emphasis on serving those most negatively impacted by the pandemic. This emphasis will need to be expanded during the build out of the city's strategy to transition into community and economic recovery. And our approach and challenge will be to equitably allocate resources for community and economic recovery in a way that also acknowledges that the funding is temporary. Many of the services that will be provided would need to be discontinued as the one-time funding is expended. To help us integrate recovery work into the city's work with the council, we'll be hosting 2 meetings at a minimum in the coming weeks. One will continue the conversation around community and economic recovery strategies and approaches that we've discussed with the council already, starting to talk about tactics and getting feedback. And the other is the mapping exercise and the resourcing of this work that will come forward through the budget process at a budget study session where we map out the available funding through the American Rescue Plan and recommendations by staff, as well as other alternative funding sources that we can bring into the budget process. So those will be coming in early May to align with the budget process. That concludes staff's presentation. Dave and Kip and Ray and I are here for any questions the council may have. Thank you, Mayor.